Hi everyone, welcome to On Point. In this video we are going to discuss about diabetes mellitus clinical manifestation, diagnosis, treatment, and prevention. If you have not watched the previous, part 1 video, then please do watch. So without any delay, let's start the video. Acute clinical manifestation. Hyperglycemia itself can cause symptoms, but usually only when blood glucose concentrations are approximately 180 mg per 100 ml, 10 ml per liter, or higher. When blood glucose concentrations increase, more glucose is filtered by the glomeruli of the kidneys, then can be reabsorbed by the kidney tubules, resulting in glucose excretion in the urine. High glucose concentrations in the urine create an osmotic effect that reduces the reabsorption of water by the kidneys, causing polyuria, excretion of large volumes of urine. The loss of water from the circulation stimulates thirst. Therefore, patients with moderate or severe hyperglycemia typically have polyuria and polydipsia, excessive thirst. The loss of glucose in the urine results in weakness, fatigue, weight loss, and increased appetite, polyphagia. Patients with hyperglycemia are prone to infections, particularly vaginal and urinary tract infections, and an infection may be the presenting manifestation of diabetes. There are two acute life-threatening complications of diabetes: hyperglycemia and acidosis, increased acidity of the blood, either of which may be the presenting manifestation of diabetes. In patients with type 1 diabetes, insulin deficiency, if not recognized and treated properly, leads to severe hyperglycemia, and to a marked increase in lipolysis, the breakdown of lipids, with a greatly increased rate of release of fatty acids from adipose tissue. In the liver, much of the excess fatty acid is converted to the keto acids beta-hydroxybutyric acid and acetoacetic acid. The increased release of fatty acids and keto acids from adipose, liver, and muscle tissues raises the acid content of the blood, thereby lowering the pH of the blood. The combination of hyperglycemia and acidosis is called diabetic ketoacidosis, and leads to hyperventilation, and to impaired central nervous system function, culminating in coma and death. Patients with diabetic ketoacidosis must be treated immediately, with insulin and intravenous fluids. Diagnosis. The disease is usually discovered when there are typical symptoms of increased thirst and urination and a clearly elevated blood sugar level. The diagnosis of diabetes is based on the presence of blood glucose concentrations equal to or greater than 126 mg per 100 ml, 7.0 ml per liter, after an overnight fast, or on the presence of blood glucose concentrations greater than 200 mg per 100 ml, 11.1 ml per liter, in general. People with fasting blood glucose values between 100 and 125 mg per 100 ml, 6.1 to 6.9 ml per liter, are diagnosed with a condition called impaired fasting glucose, prediabetes. Normal fasting blood glucose concentrations are less than 100 mg per 100 ml, 6.1 ml per liter. While the blood glucose concentrations used to define diabetes and impaired fasting glucose are somewhat arbitrary, they do correlate with the risk of macrovascular and microvascular disease. Patients with impaired fasting glucose are likely to have diabetes later in life. Oral glucose tolerance tests, in which blood glucose is measured hourly, for several hours after ingestion of a large quantity of glucose, usually 75 or 100 grams, are used in pregnant women, to test for gestational diabetes. The criteria for diagnosing gestational diabetes are more stringent than the criteria for diagnosing other types of diabetes, which is a reflection of the presence of decreased blood glucose concentrations in healthy pregnant women as compared with non-pregnant women and with men. Treatment. Treatment for diabetes mellitus is aimed at reducing blood glucose concentrations to normal levels. Achieving this is important in promoting well-being, and in minimizing the development and progression of the long-term complications of diabetes. Measurements of HbA1c can be used to assess whether an individual's treatment for diabetes is effective. Target values of HbA1c levels should be close to normal. Diet and exercise. All diabetes patients are put on diets designed to help them reach and maintain normal body weight, and they often are encouraged to exercise regularly, which enhances the movement of glucose into muscle cells, and blunts the rise in blood glucose that follows carbohydrate ingestion. Patients are encouraged to follow a diet that is relatively low in fat, and contains adequate amounts of protein. In practice, about 30% of calories should come from fat, 20% from protein, and the remainder from carbohydrates, preferably from complex carbohydrates rather than simple sugars. The total caloric content should be based on the patient's nutritional requirements for growth, or for weight loss if the patient is obese. In overweight or obese patients with type 2 diabetes, caloric restriction for even just a few days may result in considerable improvement in hyperglycemia. In addition, weight loss, preferably combined with exercise, can lead to improved insulin sensitivity, and even restoration of normal glucose metabolism. Insulin therapies. Diabetics who are unable to produce insulin in their bodies require insulin therapy. Traditional insulin therapy entails regular injections of the hormone, which are often customized according to individual and variable requirements. Beef or pork insulin, made from the pancreatic extracts of cattle or pigs, can be used to treat humans with diabetes. Modern human insulin treatments are based on recombinant DNA technology. Human insulin may be given as a form that is identical to the natural form found in the body, which acts quickly but transiently, short-acting insulin, or as a form that has been biochemically modified, so as to prolong its action for up to 24 hours, long-acting insulin. Another type of insulin acts rapidly, with the hormone beginning to lower blood glucose within 10 to 30 minutes of administration. Such rapid-acting insulin was made available in an inhalable form in 2014. Research into other areas of insulin therapy include pancreas transplantation, beta cell transplantation, implantable mechanical insulin infusion systems, and the generation of beta cells from existing exocrine cells in the pancreas. Patients with type 1 diabetes have been treated by transplantation of the pancreas, or of the islets of Langerhans. However, limited quantities of pancreatic tissue are available for transplantation. Prolonged immunosuppressive therapy is needed, and there is a high likelihood that the transplanted tissue will be rejected, even when the patient is receiving immunosuppressive therapy. Attempts to improve the outcome of transplantation, and to develop mechanical islets are ongoing. Drugs used to control blood glucose levels. There are several classes of oral drugs used to control blood glucose levels, including sulfonylureas, biguanides, and thiazolidinediones. Sulfonylureas, such as glipizide and glimepiride, are considered hypoglycemic agents, because they stimulate the release of insulin from beta cells in the pancreas, thus reducing blood glucose levels. The most common side effect associated with sulfonylureas is hypoglycemia, abnormally low blood glucose levels, which occurs most often in elderly patients who have impaired liver or kidney function. Glucometer monitoring. All patients with diabetes mellitus, particularly those taking insulin, should measure blood glucose concentrations periodically at home, especially when they have symptoms of hypoglycemia. This is done by pricking a finger, obtaining a drop of blood, and using an instrument called a glucometer to measure the blood glucose concentration. Prevention. Attempts to prevent type 1 diabetes have been unsuccessful. On the other hand, in people with impaired fasting glucose, progression to type 2 diabetes can be prevented, by weight loss and exercise and by treatment with metformin, an ACE inhibitor, or a statin, a type of cholesterol-lowering drug. That's all for now. For more updates please do like, share, and subscribe. See you in next video. Thank you.